Hello and good evening, I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Just hours ago, EPF announced a scheme called iSinar, which will permit its members who have lost their jobs or are on no pay leave to take an advance from their account one. Now, generally eligible members will have access to up to 10% of their savings in account one, which is subject to having a minimum balance of 100 ringgit. Now, those who apply for the facility will be required to replace the full amount in the future. So they're very clear saying that this is not a withdrawal, but rather an advance. You have to replace it, but no time frame is given, as I understand it.
Well, this has become a kind of a hot potato, right? A political hot potato in recent weeks, as critics of the government said there was not enough being done for the ordinary Malaysian to kind of tide over this rather difficult period, a period in which we've seen literally hundreds of thousands of Malaysians lose their jobs. And so the question is, in the debate, where do we all fall? I mean, do we see it from the perspective of the individual who says, well, I have a lifeline, I don't really care where it's coming from. If it's my money, I don't mind doing, taking from my future savings today to tide me over. Or should I be thinking about the whole system? And is the system impaired rather, if we go down this road?
Yeah, no, I've heard that before, Sharaad, the argument that this is my money, I should have access to it, especially when times are tough like right now. And I've heard politicians make that argument as well. But, more often than not, if you listen to what the experts are saying, what economists are saying, they're saying don't touch EPF money. That should be the very last resort. And I wonder whether the questions should be, if resorting to EPF withdrawals is not symptomatic of a failure of a government to take care of its people, those who need it the most. You have to understand that EPF withdrawal will not solve everyone's problems. Half of Malaysians aren't even, active EPF members. So that's just one solution. Perhaps the other thing we can think about is really, what other ways can government facilitate transfers to those who are most vulnerable? Yeah,
but okay, in the kind of what would be perfect, or if we had a perfect government that did everything that we wanted it to do, kind of scenario building on one side, you think about what is practical. This is something that you have easy access to. This is yours. And you're not thinking about everybody else. You're just thinking about how you survive. We are in an extremely privileged position of still having our jobs, not getting pay cuts and so on and so forth. And so, meeting our obligations is very easy. But if you are leveraged, house loan, car loan, children's education, especially if you're middle class and you might be overly leveraged as a middle class person, what do you do?
All right. I mean, this is one for economists, and clearly, they're going to have to debate this in Dewan Rakyat as well. I'm sure it's going to be a subject of much debate in the days to come.
Yeah, not many economists, I think, in Dewan Rakyat. I think the Dewan Rakyat, in fact, is filled with politicians.
Well, politicians who are also looking to some pass the budget, also others looking to fight for political capital. All right, well, let's take a look at other news today. Police have found the COVID-19 patient who had fled from that Penang hospital yesterday. He has been found. The man had allegedly left his pink wristband on the hospital bed before escaping the COVID-19 ward, and he was picked up by medical staff some 25 kilometers from the hospital where he allegedly walked that distance. I think, Sharaad, this is quite interesting to look at this story beyond just the headlines, beyond the headlines of this man who escaped from a COVID-19 ward, but rather to think about it, or to kind of look at why it is that we have, people who want to flee from COVID-19 wards, from government surveillance, from EMCO areas, right?
Yeah, fascinating, because there's a level of, like personal psychology involved. Yeah. We're often in hospital because we want to be there. We enter voluntarily, and we're kept there. We perceive it as such for our own good. But what happens when that level of voluntarism is taken out of the equation, and you're asked to remain not just for your own good, but for the good of others? And I think that changes the equation for some people.
Well, I wonder whether, after so many months of having to deal with this pandemic, that there's still a failure of public awareness and education. I really want to stress this in terms of health literacy, knowing that by leaving the hospital, you are endangering others, not just yourself, knowing, that could be one of the reasons why. And I wonder whether we should be thinking about whether public education, after so many months, has failed to reach those who might need it the most.
Well, it's about public education at some level. It could be simply about personal and self-interest, right? So individuals could be very selfish, could privilege their needs over others, and also they might be, and that's the other side of the story, you might not have a system that is designed to be responsive to the particular needs of people. So it's all great to have these blanket, solutions for the population or some segment of the population. But what if they have special needs? What if you're trapped in a situation, but you have dependents, for instance, or you're the only bread winner for your family?
Correct.
I mean, there might be a myriad of reasons that force you to think about escaping being a word, sort of getting yourself out of that situation.
And I think this merits a lot more thought and consideration, especially also pointing to the residents of Medan 88 who apparently have yet to return to the area that's under EMCO, and it's made me think about some of the reasons, perhaps not just the imperatives of needing to survive and to work or to get a living, but also whether there's distrust to the system, to authorities. And I wonder whether the fear of authorities is so overwhelming that it actually overwhelms the fear of the disease, the fear of the pandemic. And that's something we really need to consider.
Well, there's also the tone that politicians take when, addressing the media as a conduit for the larger, to get information out to the larger public. But it's not just the information, but also the tone, right? The way in which, certain leaders have sought to take a very tough stance and lay down the law and say, we'll come after you, which is then amplified by the media. I mean, that surely doesn't build bridges and doesn't make for a situation where people feel comfortable to come back, because it kind of almost be told, come back and we'll punish you.
Right, exactly.
And it is really different. We're talking about psychology here. We're talking about the way to manage people and a whole range of personalities. And that's why we need more than just politicians to take the lead on this. We need more than just doctors to take the lead on this. We need all kinds of experts who can weigh in on how people are behaving and shaping their response to this particular public health crisis.
Exactly, well put. All right, we're going to take a quick break, but on a related note, after this, we're going to be focusing on construction site clusters. Are they another instance of policy blind spots and failure in the management of COVID-19? All of that coming up in just a couple of minutes. Stay tuned to consider this. Hi, you're watching Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. The Damanila construction site COVID-19 cluster has alerted observers to what could be another policy blind spot in managing the public health crisis. Along with prisons and detention centres, living and work conditions at construction sites have come in for greater scrutiny. Now, the Consider This team reached out to the Office of the Works Minister and also the Construction Industry Development Board for comment, but both declined to be interviewed tonight. However, joining us on the show now, we have Jarud Romadan. He's a research associate at Khazanah Research Institute, and he recently co-authored a discussion paper arguing for better foreign worker protection. Jarud, good evening. Now, in May, June, there was an emergence of clusters among foreign workers that raised concern of public health officials, and there were calls then for educating foreign workers as well as improving the working and living conditions that predispose them to higher risk of infection. Now we hear the same red flags being raised. I'm wondering whether you think we've done enough in the past couple of months to avoid another wave of infection from these clusters.
Hi, thank you for the question, and thank you for having me. Yep, I definitely agree that the emergence of clusters among foreign workers raises a few red flags because it's basically signaling that there's still much that we need to do to prevent infections among migrant workers. When it comes to the infection of COVID-19 among migrant workers in Malaysia, a lot of attention has been on their living standards. I think the Director General of Health himself stated that in the middle of this year. But we need to realize that decent housing isn't just for Malaysians, it should be for everyone, including migrants. And I'm glad that the Act was amended. But if we scrutinize it a bit more, there are a few areas that can be improved. So, for example, in the amended Workers' Minimum Standards of Housing and Amenities Act, I hope I get that correct, it only applies to employers who provide accommodation. So then what happens to foreign workers who have employers that do not give any sort of accommodation? What about their well-being, whether their accommodation meets these standards or not? Considering the low pay that a lot of migrant workers receive, it's totally understandable that many of them choose to pool their resources and to share one small room with a number of migrant workers. So then the question is, can they practice social distancing? These are sort of the things that I think the Act can be further improved. And we can learn from, other experiences from other countries. Singapore, for example, they similarly experienced a spike in cases among migrant workers, and they acted by ensuring that migrant workers were placed in interim housing, allowing them to practice these precautionary measures. And also, on the way, they are learning the lessons from the pandemic and improving housing standards for all migrant workers.
Right. Jarud, can I ask you, to focus on the Singapore example, because the Singapore example is interesting because the dormitories that became a policy blind spot for the Singapore government and a source of many of the infections was in fact a step in the right direction, as it were. It was more like Malaysia before the dormitories were put together. The dormitories were in essence about upping standards and standardizing a worker accommodation. But of course, the pandemic hadn't been factored in, or that kind of situation. So do you think Malaysia should, in terms of policy, be thinking of kind of leapfrogging from our current situation to a kind of Singapore solution but post-COVID?
Yep. I think that's not there's no direct answer, because Singapore, it's a different sort of city-state, whereas Malaysia is a more diverse economy. Workers living in rural areas and urban areas, I think there's a bit of a different situation there, and those things need to be taken into consideration. But in terms of housing standards, there's definitely much that we need to improve. If I'm taking, I'm not a housing expert, for example, but learning from some of my colleagues in KRI who form the housing team, there is no standard definition of decent housing, for example, in Malaysia. So they are standard references, but I think we need to set a standard on what is decent housing, not only for migrant workers, actually for everyone, because housing is part of our determinant of health, and it's important for us to get this right, because dealing with a pandemic, those kind of things matter. in ensuring that we break the transmission of COVID.
Well, in your paper, you make the case for the protection of foreign workers. And I'm wondering, Jarud, who is it that should be responsible? Is it the employers of the foreign workers that should be responsible for their health and well-being? Or should this be government, because it is a vulnerable segment of society and will, in fact, impact all citizens as well, because the pandemic does not discriminate? What imperative? Should it be a policy imperative? Should it be a commercial imperative? What do you think?
I think it's not like a one-party solution. Sorry, that's a bit political. It's not like a solution that should be just taken over by one party. Everyone has to play their part. On the side of the government, for example, they need to make sure that there are policies in place that ensure the welfare of everyone regardless of citizenship. This means ensuring that employers are acting responsibly for the well-being of their employees. Foreign workers have access to healthcare facilities, etc. We need to shift our mindset into understanding that foreign workers are part and parcel of our society. They are crucial to the development of Malaysia. They built KLCC, they were part of the team that built KLIA. So to benefit from the labor of migrant workers, but then to basically exclude them during a time of crisis is not, it's quite shameful. And during Budget 2021, I can't remember any measure that specifically directly benefits foreign workers. And in the past, there were statements made by government officials whereby the welfare of foreign workers is the direct responsibility of their respective embassies, and the government would only take an assisting role. But aside from that, even employers should be accountable for the well-being of their workers, because they're benefiting from employing low-cost foreign workers working 6-7 days a week with barely any breaks. So they can't turn a blind eye when there is when the foreign workers' health is at risk.
Jarud,
everyone is.
Yeah, can I ask a bit? It seems that there are a lot of good people out there, making suggestions to government, but policy formulation in this country is a bit of a black box, in which it's very hard to understand how policies are actually determined or formulated in this country. What do you think needs to happen in terms of the conversation? Because it sounds like this is a conversation we're going to be having 6 months down the road, a year from now, 2 years from now. What will push the needle on this conversation and get policymakers to actually act on what we're seeing happening today?
I think when it comes to the management of foreign workers, there's a lot of contentious issues, and that's partly because there's a lot of things we don't understand. When you talk about foreign workers, that's mainly documented and undocumented. There's about 2 million undocumented migrant workers last year. I think it's much smaller now since a lot of people left. About undocumented migrant workers, that's a big elephant in the room, which I think we need to address, and we cannot turn away anymore from it. And all of this missing information leads to misinformation and disinformation, leading to increased xenophobia, which we're actually seeing right now in terms of policies. For example, we do not want to formulate policies that discriminate based on citizenship, for example. Right. And we do not want to formulate policies based on misinformation. For example, there's a lot of xenophobia against migrant workers for being disease spreaders, when in fact, if you look at publicly available data, migrant workers who come to Malaysia are actually one of the healthiest bunch, because when you look at data of their health checkups in their home country and in Malaysia, most of them do splendidly well. And then the question is, then why do their health status become worse in Malaysia? That's a structural issue that is not necessarily at the fault of the migrant workers. So those are sort of misinformation that we need to address. And then COVID specifically, there were a lot of blame on migrant workers for bringing in COVID. But when you look at imported cases, most of the imported cases are actually from Malaysians coming in from doing their studies abroad, working abroad, traveling and having fun. So those kind of misinformation would lead to the wrong policy formulations, and I hope there are ways that we can do to get more information on migrant workers.
Well, Jarud, thank you so much for speaking with us and sharing those really interesting insights. We really appreciate your time. We're going to take a quick break here and consider this. We'll be back with more. Stay tuned. right, thank you so much for staying with Sharaad and I on Consider This. Let's continue our look at construction site clusters. Are they another instance of policy blind spot or failure in the management of the COVID-19 pandemic? Joseph Paul is a case officer with the workers' rights NGO Tenaga Nita. Joe, good evening. Now, are you surprised that we are still seeing clusters emerge from construction sites? I mean, even after all that focus on foreign worker living conditions at the onset of the pandemic a few months ago.
Yeah, hello. Yes. Am I surprised? Well, not really, because if something to change, if there is to be any improvement, things have to change. And I don't think there has been much change in the living conditions of migrant workers, right? Of course, we have had the amendments to the Act, which everybody is talking about, but as expected, the employers have been asking for deferment of the implementation, and so it is now finally supposed to be implemented. I think it's in September the 1st, I think, right? But the question is it actually being monitored? Is anybody checking on whether actually anything has changed? Because the Act requires a certificate of accommodation at the CFA, I think, and before people can actually live in those accommodations. But I haven't heard about anybody trying to get this certificate of accommodation and anybody being prosecuted for not complying to them. Right. So the short answer is, to a question is, well, I'm not really surprised that the infections at this kind of sites are still going on, because they provide the perfect conditions for the virus to transmit and to grow.
Joseph, from your experience, working in an organization that has direct contact with workers, locals, and in particular migrant workers, what are you hearing from them about the way in which this pandemic has affected their lives and their choices in either trying to create a much more secure environment for themselves, free of the virus, or at least mitigating possibility of transmission and such? I mean, what stories are you hearing from the ground?
Well, one thing I can say is that the workers are quite aware of what they should be doing: washing hands, wearing masks, keeping physical distance, But the thing is, they do not have much choice. Those who are able to, and I've come across some workers who say, look, we prefer to stay out on our own because, the conditions that are provided are not at all conducive for a healthy living. So those who can, some of them can, and then they go and get themselves some own accommodation. But by and large, they would have to rely upon the accommodation that is provided, which is still far from satisfactory. So really they're caught between, I don't know what you'd call it, a rock and a hard place, or basically option choice. Either they don't work, which means then, well, you know what it means, or they have to wing it and try the best and see that they don't get infected.
Right.
So, yeah.
So I wanted to ask you about the SOPs, the SOPs for screening and testing of migrant workers, whether those SOPs have actually been easy to comply with, or have they been made so difficult that it's difficult for migrant workers to comply with, and therefore they try to work around it?
No, actually, in terms of the testing and stuff like that, it is quite. From what I hear, that this is being actually implemented in most construction sites that I've come across. They follow it, right? But then again, as you all know, that just because you're tested okay today doesn't mean that for the rest of your life you're free from being infected. So that's one thing. Secondly, of course, there are still many undocumented migrant workers, and these are the ones who would not want to go and get tested or get treated, even if they have the symptoms, simply because experience has shown that they will probably end up in detention centers, which are, in fact, much worse than the accommodation that they have. Which leads me to the next question sometimes. The next point that I want to bring up here is that you talk so much about the accommodation of migrant workers, right? But we also need to look at the kind of accommodation that, I mean, another hotbed for infection, which are the government facilities, prisons and detention centers and lockups. They are just as bad, perhaps even worse, than the minimum standards that are prescribed for migrant workers.
Joseph, do you sense a shift in government attitudes towards, especially the undocumented migrant workers? Where 6 months ago we talked about how there was need to build trust and build bridges in order that they could be drawn into the public health response. And then the government did undermine its own efforts by actually detaining them and so on and so forth in very spectacular ways. Do you see a shift in the government's approach? I mean, or are we still stuck at the same place that we were 6 months ago?
Honestly, I don't see any change. It's just that perhaps they do not have those massive raids that we are used to, maybe because they themselves are afraid to go and get infected. But there is no change in the attitude, because, I mean, if somebody has a symptom and goes to get tested, chances are that he's going to be detained anyway. Right. The only shift that I will come across is the recent announcement that they want to provide some work permits and for undocumented workers to hire them, right? That is the only kind of shift that they have. That means they begin to accept the fact that there are these undocumented migrants in our midst, and there's a big need for their services. And so, of course, another opportunity to make some money out of them. And so we offer them a chance to get a short-term visa to work.
Joseph, thank you so much for speaking with us on the show tonight. We really appreciate your time. That's all we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching, and good night.